There is a woman who spent 11 years unable to sleep through the night. Every single night, somewhere between 2 and 4 in the morning, she would wake up drenched in sweat, heart pounding so hard she could feel it in her throat, her body rigid, her breath shallow and fast, her mind replaying a scene that happened over a decade ago, as if it were happening right now, right there in her bedroom. She tried therapy, she tried medication, she tried meditation apps and lavender oil and white noise machines. Nothing worked, not because those things are useless, but because they were all trying to fix her mind, and her mind was not the problem. What was wrong with this woman was not psychological. It was not a thought pattern or a belief she needed to change. What was wrong with her was physical, neurological, measurable on a laboratory instrument. Her vagus nerve, the longest nerve in her entire body, the nerve that connects her brainstem to her heart, her lungs, her gut, and nearly every major organ, had been damaged by trauma. Not metaphorically damaged, physically damaged. Its tone had collapsed. Its ability to activate her parasympathetic nervous system had been severely impaired, and until someone addressed that nerve directly, no amount of talk therapy was going to give her a full night of sleep. This is a story that millions of people around the world are living right now without understanding why nothing seems to help. I am going to tell you something today that could change the way you think about post-traumatic stress disorder forever. What the medical world has called a mental illness for decades is increasingly being understood by neuroscientists as a nervous system injury. That is not my opinion. That is the direction the research is heading, and the implications are enormous. Because if post-traumatic stress disorder is a nervous system problem, then the solution is not just psychological, it is physiological. And there are practices, simple practices, that require no medication and no equipment, that can begin to reverse the damage. Not manage it, not cope with it, reverse it. That word matters, and the science behind it is now strong enough to use it. Before we go any further, I need to explain what actually happens inside your body when trauma occurs. Not what happens in your mind, what happens in your nervous system. Because this is where everything starts. And this is where the medical conversation has been incomplete for a very long time. Your autonomic nervous system has two main branches. The sympathetic branch, which activates your fight or flight response, and the parasympathetic branch, which activates your rest and repair response. In a healthy nervous system, these two branches work together like a gas pedal and a brake. Threat appears, the gas pedal engages, threat passes, the brake kicks in, you return to baseline. But Dr. Stephen Porges, a neuroscientist at Indiana University, discovered something that changed everything we knew about this system. He found that the parasympathetic branch is not one single system. It has two completely separate pathways. And this distinction is the foundation of what he calls polyvagal theory. The first pathway is the ventral vagal pathway. This is your social engagement system. When this pathway is active, you feel safe, connected, calm, and present. Your heart rate is steady. Your breathing is slow. Your facial muscles are relaxed. Your voice has natural warmth and rhythm. This is the state most people think of when they imagine relaxation. It is the state your body was designed to spend most of its time in. It is where healing happens, where digestion works properly, where your immune system functions at its best. The ventral vagal state is not just pleasant. It is essential for survival. The second pathway is the dorsal vagal pathway, and this is where trauma lives. The dorsal vagal pathway is ancient. It evolved hundreds of millions of years before the ventral pathway. It is the system that reptiles use. When a threat becomes so overwhelming that fighting is impossible and fleeing is impossible, the dorsal vagal system activates a shutdown response. It is the biological equivalent of playing dead. Heart rate plummets, blood pressure drops, the body becomes immobilized. The mind dissociates. You are physically present but neurologically absent. This is not a choice, this is a reflex. It happens below the level of conscious awareness. And it is the nervous system's last resort when survival is at stake. Here is the part that changes everything about how we understand post-traumatic stress disorder. In a healthy nervous system, after the threat passes, the body moves back through sympathetic activation. It releases the stored survival energy through trembling or crying or deep breathing, and then it returns to ventral vagal safety. Animals do this naturally. A gazelle that escapes a lion will shake violently for several minutes, then stand up and walk away as if nothing happened. Its nervous system completes the cycle. The energy is discharged. The threat response resolves fully. But humans often do not complete this cycle. We suppress the trembling. We hold back the tears. We tell ourselves to be strong. We push through. And when we do that, the dorsal vagal shutdown does not fully release. The energy stays trapped in the body. The nervous system gets stuck, not in fight or flight, although that happens too. It gets stuck in a loop between sympathetic hyperactivation and dorsal vagal shutdown. One moment your heart is racing and you cannot calm down. The next moment you feel nothing at all, numb, disconnected, empty. These are not psychological symptoms. These are neurological states. They are the signatures of a vagus nerve that has lost its ability to regulate the transition between activation and calm. And this is what post-traumatic stress disorder actually is at the biological level. It is a vagus nerve that has been knocked out of its natural rhythm by an overwhelming experience and has never found its way back. And the consequences go far beyond flashbacks and nightmares. When your vagus nerve loses its tone, your entire body pays the price. The vagus nerve controls your heart rate, your digestion, your immune response, and your inflammatory markers. When that nerve is chronically impaired, every system it touches begins to malfunction. This is why people with post-traumatic stress disorder have significantly higher rates of heart disease, autoimmune disorders, chronic pain, and digestive problems. These are not coincidences. These are direct consequences of a vagus nerve that can no longer do its job. When the parasympathetic brake fails, the sympathetic gas pedal runs unchecked. Cortisol stays elevated. Inflammatory cytokines flood the bloodstream around the clock. The immune system stays in combat mode, attacking the body's own tissues instead of repairing them. A study published in the journal Psychoneuroendocrinology measured the vagal tone of combat veterans with post-traumatic stress disorder compared to veterans without the condition. The difference was stark. The veterans with the disorder had vagal tone measurements that were roughly 40% lower than their counterparts. That is not a subtle variation. That is the difference between a nervous system that can self-regulate and one that cannot. And here is what nobody told those veterans. The vagal tone loss was not permanent. It was reversible. With the right kind of stimulation, the vagus nerve can rebuild its strength, the same way a weakened muscle can be rehabilitated through targeted exercise. There is another layer to this that rarely gets discussed. When your vagus nerve is impaired, your gut suffers directly. The vagus nerve is sometimes called the gut-brain axis because it carries more information from your gut to your brain than from your brain to your gut. Roughly 80% of the signals travelling through the vagus nerve are afferent, meaning they go upward from body to brain. When vagal tone is low, those signals become distorted, digestion slows down, the gut lining becomes more permeable, inflammatory compounds leak from the gut into the bloodstream. These compounds cross the blood-brain barrier and create neuroinflammation, which further impairs vagal function. It becomes a vicious cycle. Low vagal tone damages the gut. The damaged gut further lowers vagal tone. This is why so many people with post-traumatic stress disorder develop irritable bowel syndrome, food sensitivities, and chronic fatigue. These are not separate conditions that happen to coincide with trauma. They are downstream effects of the same underlying problem. A vagus nerve that was knocked offline by an overwhelming experience and never recovered. Understanding this changes everything about how recovery works. Now let me tell you about something that happened recently that stunned the entire neuroscience community. In 2025, a team at the University of Texas at Dallas led by Dr. Michael Kilgard, published the results of the largest clinical trial to date using vagus nerve stimulation for treatment-resistant post-traumatic stress disorder. These were patients who had tried everything: therapy, medication, years of treatment with no improvement. They still carried their diagnosis. They still lived with flashbacks, hypervigilance, emotional numbness, and sleep disruption every single day of their lives. The researchers paired traditional exposure therapy with direct electrical stimulation of the vagus nerve through a small device implanted near the neck. After 12 sessions, the results were assessed over the following 6 months, and what they found was unprecedented. Every single patient in the trial lost their post-traumatic stress disorder diagnosis. 100%, not improved, not partially better, completely free of the diagnostic criteria for the disorder they had carried for years. Dr. Kilgard himself said that in a typical trial, some patients get better, but they rarely lose their diagnosis entirely. In most cases, the majority will carry it for the rest of their lives, but in this trial, every single one recovered. The benefits persisted for at least 6 months, with no serious side effects. The mechanism was clear: stimulating the vagus nerve while the patients confronted their traumatic memories accelerated the brain's ability to rewire itself. It enhanced neuroplasticity in the circuits responsible for fear extinction. The vagus nerve was not just calming the patients down, it was helping their brains create entirely new neural pathways that replace the traumatic patterns with associations of safety. Now I want to be honest with you. Most people do not have access to an implanted vagus nerve stimulator. That technology exists, but it requires surgery, and it is not yet widely available for this purpose. However, and this is the critical point, the vagus nerve can be stimulated without any device at all. Your body has natural pathways for activating this nerve. They have been used for thousands of years by traditions that did not have a name for what they were doing. Controlled breathing activates the vagus nerve. Specific patterns of breathwork can increase vagal tone measurably. An increased vagal tone is exactly what begins to reverse the nervous system patterns that sustain post-traumatic stress disorder. If you are finding value in what you are hearing right now, take a moment to subscribe to this channel and leave a like on this video. Every subscription helps this content reach someone who might be suffering in silence, thinking their only options are medication or years of talk therapy. There is much more to this story. Let me explain what happens inside your body when you practice a specific breathing technique that targets the vagus nerve directly. The pattern I am about to describe is not a relaxation exercise. It is a neurological intervention that works by sending a signal from your body to your brainstem. That signal directly activates the ventral vagal pathway, the exact pathway that trauma has suppressed. The breathing pattern is deceptively simple. You inhale through your nose for a count of 4. You hold briefly for a count of 2. Then you exhale through your nose for a count of 8. The exhale is twice as long as the inhale. That ratio is not arbitrary. When you inhale, your heart rate increases slightly. This is called respiratory sinus arrhythmia, and it is normal and healthy. Your sympathetic nervous system gets a small push. When you exhale, your vagus nerve fires. Acetylcholine is released at the sinoatrial node of your heart, and your heart rate decreases. The longer your exhale, the more time your vagus nerve spends activated in each breath cycle. At a 4:8 ratio, you spend roughly 65% of each breath cycle in active vagal stimulation. Over the course of 10 minutes, that produces a measurable shift in heart rate variability, which is the gold standard measurement of vagal tone. Here is what makes this particularly relevant for people with post-traumatic stress disorder. The dorsal vagal shutdown that characterizes trauma is essentially the nervous system's circuit breaker tripping. Too much activation, too fast, with no resolution. The ventral vagal pathway goes offline. The body loses access to its social engagement system and its capacity for emotional regulation. Extended exhale breathing does something remarkable. It reactivates the ventral vagal pathway from below, not by thinking about safety, not by talking about trauma, but by sending a physical signal through the vagus nerve. that tells the brainstem the environment is safe enough for the social engagement system to come back online. Think about what that means for a moment. For years, maybe decades, a person with post-traumatic stress disorder has been trying to think their way out of it, trying to rationalize the fear, trying to convince themselves they are safe, and their body ignores every single word. Because the body does not listen to thoughts, the body listens to signals, physical, measurable, neurological signals that travel along specific nerve pathways. And the strongest signal your body can receive that you are safe is a long, slow exhale that activates the vagus nerve at the brainstem level. This is why people with post-traumatic stress disorder often report that they feel something shift during breathwork that they never felt during years of talk therapy. The shift is not cognitive, it is autonomic. The nervous system is receiving a signal it has not received since before the traumatic event, a signal of safety at the physiological level. For a nervous system that has been locked in defensive mode for years or even decades, receiving that signal for the first time is profound. It is like opening a door that has been sealed shut. The body does not just relax. It remembers what relaxation actually feels like. And that memory is stored not in the mind, but in the nervous system itself. There is a second practice that is equally powerful for recovery, and it works through a completely different vagal pathway, humming. Specifically, low-pitched, sustained humming with the lips closed and the breath flowing through the nasal passages. The vagus nerve has a branch that innervates the larynx, the muscles of the throat, and the middle ear. When you produce a sustained vocal vibration, that branch of the vagus nerve is directly stimulated. The vibration travels along the nerve and creates what researchers call a bottom-up activation of the parasympathetic system. The term bottom-up is important. It means the signal starts in the body and travels up to the brain, not the other way around. This bypasses the cognitive processing centers that are often hijacked by traumatic memories. It goes directly to the brainstem. A study from the International Journal of Yoga found that sustained nasal humming produced significant increases in parasympathetic activity within just 5 minutes. The participants showed increased heart rate variability, reduced blood pressure, and elevated nitric oxide levels. What makes humming particularly valuable for trauma survivors is that it does not require stillness. Many people with post-traumatic stress disorder cannot sit still with their eyes closed. The hypervigilance makes it unbearable. Humming can be done with eyes open, it can be done while walking, it can be done while gently rocking, which itself activates vestibular pathways that support vagal regulation. There is also a neurochemical component to humming that is worth understanding. When you produce a sustained low-frequency vibration in your throat, the vagus nerve signals the release of oxytocin from the hypothalamus. Oxytocin is sometimes called the bonding hormone, but its effects go far beyond social connection. It directly counteracts cortisol, it reduces inflammation, it lowers blood pressure, and it creates a subjective sense of warmth and safety that many people with post-traumatic stress disorder have not felt in years. This is not a minor detail. One of the most common complaints from people with chronic trauma is that they never feel safe. Not in their home, not in their bed, not even alone. That persistent sense of threat is not a thought problem, it is a neurochemical problem. When cortisol is chronically elevated and oxytocin is chronically suppressed, safety becomes biochemically impossible. Humming begins to correct that imbalance from the first session. Let me tell you about something that made a real difference for me personally. There is a protocol called the Vagus Nerve Reset Protocol. I followed each step in it, and it shifted something deep in the way my body responds to stress and pressure. It covers far more than anything I can fit into a single video. It is a complete system for strengthening the vagus nerve from multiple angles and building the kind of resilience that changes your baseline, not just your momentary state. Inside, you will find breathing methods designed for specific situations, vocal techniques that engage vagal pathways directly, cold exposure practices rooted in the mammalian dive reflex, and a structured approach for resetting the freeze response. It works your nervous system from the inside out, and your body responds quickly when you give it the right kind of input. Most people who follow it consistently notice meaningful changes within the first couple of weeks. The link is in the description and pinned in the comments. The longer you wait, the deeper the pattern sets. Break it today. Now let me give you a complete protocol you can start tonight. Not next week. Tonight. I want to be very specific because the details matter. Find a place where you will not be disturbed for 10 to 15 minutes. You can sit in a chair, sit on the floor, or lie down. If lying down makes you feel vulnerable, sit upright with your back supported. Keep your eyes open if closing them creates anxiety. There is no rule that says you must close your eyes for this to work. Your nervous system does not care whether your eyes are open or closed. It cares about the rhythm of your breath and nothing else. Place one hand on your chest and one hand on your belly. This is your feedback system. When you breathe correctly, your belly hand should rise first on the inhale. Your chest hand should move very little. If your chest is rising first, you are breathing into your upper lungs, which activates your sympathetic nervous system. Belly breathing activates the diaphragm, which sits directly against the vagus nerve. Every time your diaphragm descends on an inhale, it physically compresses the vagus nerve. Every time it rises on an exhale, it releases that compression. This mechanical stimulation is one of the primary ways breathing directly affects vagal tone. Now begin the pattern. Inhale through your nose for 4 counts. Let your belly expand naturally. Do not force it, hold for 2 counts. This brief pause at the top of the inhale allows for maximum gas exchange in the alveoli of your lungs. Then exhale through your nose for 8 counts, slowly, gently. Let the breath leave your body like water draining from a bathtub. No pushing, no forcing. Just a slow, steady release. When you reach the bottom of the exhale, do not gasp for the next breath. Let the inhale arise naturally. Let your body decide when it needs to breathe in again. This moment between exhale and inhale is where the deepest vagal activation occurs. Do this for 5 minutes, just 5 minutes. During those 5 minutes, your body will begin to shift. You may feel a tingling in your hands or feet. That is peripheral vasodilation. Blood flowing back to your extremities as the parasympathetic system activates. You may feel your muscles start to soften, particularly in your jaw, your shoulders, and your belly. Those are the areas that hold the most tension in people with chronic trauma activation. Your jaw clenches because the dorsal vagal system tightens the muscles of mastication when it perceives threat. Your shoulders rise toward your ears because the sympathetic nervous system is preparing your upper body to defend itself. Your belly hardens because the diaphragm contracts, pulling upward, restricting the very movement that would stimulate your vagus nerve. When these areas begin to release during the practice, it is a direct sign that the autonomic shift is occurring. You may also feel a wave of emotion, sadness, grief, relief, sometimes anger, sometimes a feeling that has no name at all, just a heaviness that begins to lift from somewhere deep inside your chest. This is normal and it is healthy. When the nervous system starts to come out of defensive mode, stored emotions can surface. Do not fight them. Do not analyze them. Do not try to understand where they came from. Just let them move through you while you continue breathing. They will pass. They always pass. There is something else that happens around the 3 to 4 minute mark that catches many people off guard. Your body temperature may shift. Some people feel a warmth spreading through their core. Others feel cool air moving through their nasal passages more distinctly. Both of these are signs that your autonomic nervous system is transitioning. The temperature regulation centers in your hypothalamus are directly influenced by vagal tone, and as your parasympathetic system comes online, those centers begin to recalibrate. After 5 minutes, add the humming component. Keep the same breath ratio if you can. Inhale through your nose for 4 counts, then instead of a silent exhale, hum on the exhale for 8 counts. Keep the pitch low. You should feel the vibration in your chest, your throat, and ideally in the center of your head behind the bridge of your nose. That vibration in the nasal cavity stimulates the sphenopalatine ganglion, a cluster of nerve fibers connected to the parasympathetic system. The lower the pitch, the stronger the vagal stimulation. Do not hum a melody, just a single sustained tone, like the sound of a distant engine, or the sound a cat makes when it purrs. The vibration itself is the medicine. Continue the humming for another 5 minutes, so now you have done 10 minutes total. 5 minutes of silent extended exhale breathing, followed by 5 minutes of humming breath. In that 10 minutes, you have stimulated your vagus nerve through 3 separate pathways simultaneously: diaphragmatic compression, extended exhale activation, and laryngeal vibration. Each pathway independently increases vagal tone. Together they create a compound effect that is significantly more powerful than any single technique alone. This is not speculation. This is based on published research measuring autonomic markers before and after combined vagal toning protocols. I want to talk about what happens when you do this consistently over time, because a single session will make you feel better, and that is real, and it matters. But the transformative change happens through repetition. Your vagus nerve is like a muscle in one important respect. It responds to training. Every time you activate it through breathwork or humming, you strengthen its tone slightly. Over days and weeks, those slight increases compound. Your baseline vagal tone starts to rise. And that baseline change is what shifts your nervous system out of the trauma pattern permanently, not just for the duration of the practice, but throughout your entire day, even while you sleep. This is the mechanism that explains why the University of Texas patients lost their diagnosis entirely. Their vagal tone was restored to a level where the trauma pattern could no longer sustain itself. In the first week of daily practice, most people notice improved sleep quality. Not perfect sleep, but the kind of improvement where you wake up feeling like you actually rested instead of just lying there with your eyes closed for 8 hours. The nighttime hyperactivation starts to soften. The 2 a.m. wake-ups become less frequent. The time it takes to fall back asleep decreases. This happens because the extended exhale breathing done before bed shifts the nervous system into parasympathetic dominance. And as vagal tone improves, that shift holds through more of the night instead of collapsing back into sympathetic activation at the first minor disruption. By the second week, something more significant begins to emerge. The hypervigilance decreases. That constant scanning of the environment, that feeling that something bad is about to happen, that tension in your chest that never quite goes away. It starts to ease, not because you have processed the trauma cognitively, but because your vagus nerve is getting strong enough to activate the ventral vagal pathway more reliably. Your neuroception, your body's unconscious assessment of safety, starts to shift. The world begins to feel slightly less threatening, not because the world changed, but because your nervous system changed how it interprets the signals it receives from the environment. By the end of the first month, many people experience what they describe as a gap, a space between a trigger and their reaction that was not there before. Something that would have sent them into a flashback or a panic response now produces a brief moment of awareness, a moment where they can feel the old pattern trying to activate, and they can breathe through it before it takes over. That gap is the ventral vagal brake engaging. It is the vagus nerve doing its job, providing a buffer between the stimulus and the survival response. And that gap grows wider with every week of consistent practice. This is where the real freedom begins. After 2 to 3 months, the changes become structural. Brain imaging studies on people who practice vagal toning techniques show increased grey matter density in the prefrontal cortex, the area responsible for emotional regulation and executive function. They show decreased activity in the amygdala, the brain's threat detection center. And they show improved connectivity between these regions, which means the brain is better able to modulate fear responses in real time. These are not subtle changes, these are the kinds of changes that show up on an MRI. And they are produced not by medication, not by surgery, but by breathing in a specific pattern for 10 to 15 minutes a day. After 2 to 3 months, other people notice the change. Friends comment that you seem calmer. Colleagues remark that you handle pressure differently. Your doctor may find that your blood pressure has come down, or that your resting heart rate has decreased. These are not placebo effects. These are documented changes in autonomic nervous system function that have been demonstrated in peer-reviewed research across multiple institutions. There is something else that happens at the 3-month mark that deserves attention. Your relationship with sleep fundamentally changes. For people with post-traumatic stress disorder, sleep is not rest. It is a battlefield. The hypervigilant nervous system does not want to let go of consciousness, because unconsciousness feels like vulnerability. But as vagal tone builds, the nervous system begins to trust that it is safe enough to shut down for the night. Sleep onset becomes faster. Sleep architecture improves, meaning you spend more time in the deep restorative stages, and perhaps most importantly, the nightmares begin to lose their intensity. This does not mean the memories disappear. The memories are still there, but the emotional charge attached to them diminishes as the vagus nerve strengthens. The memory of what happened stops triggering a full survival response, because the nervous system can now process it without being overwhelmed. This is what neuroscientists call fear extinction. Not forgetting, not suppressing. Extinction. The association between the memory and the threat response weakens until it no longer fires automatically. There is another change at the 3-month mark that people rarely talk about, but that matters enormously. Your capacity for connection returns. One of the most devastating aspects of post-traumatic stress disorder is the isolation it creates. When the ventral vagal pathway is offline, the social engagement system shuts down. Eye contact feels uncomfortable. Conversation feels exhausting. Intimacy feels threatening. You withdraw, not because you want to be alone, but because your nervous system cannot tolerate the signals that come with human connection. As vagal tone rebuilds, the ventral vagal pathway comes back online, and with it comes the capacity for co-regulation, the ability to feel calm in the presence of another person. This is often the change that matters most to people in recovery, not the absence of flashbacks or the improvement in sleep. Although those matter deeply, it is the moment they realize they can sit next to someone they love and actually feel them, feel their warmth, feel their presence, feel safe enough to let someone in. I want to address something important for anyone listening who has severe post-traumatic stress disorder. This practice is not a replacement for professional care. If you are working with a therapist, a psychiatrist, or any other healthcare provider, continue that relationship. What I am describing here is a complement to treatment, not a substitute for it. The breathing and humming techniques can enhance whatever therapeutic work you are already doing, because they work at a level that talk therapy alone cannot reach. They address the physiological substrate of the disorder, the nervous system damage that keeps the symptoms in place even when you understand them intellectually. Many trauma therapists are now incorporating vagal toning techniques into their clinical practice precisely because they accelerate recovery. I also want to acknowledge that for some people, the first few sessions can be uncomfortable. When you begin to shift your nervous system out of a pattern it has been locked in for years, the transition can feel unsettling. You might feel more emotional than usual. You might feel exhausted after a session. You might even feel temporarily worse before you feel better. This is not a sign that something is going wrong. This is a sign that something is finally moving. Think of it like physical therapy after an injury. The first sessions are the hardest, but each one builds on the last. And the trajectory is always toward recovery. Trust the process. Trust your body. It knows how to heal when you give it the right input. Let me address one practical question that people always ask. What is the best time of day to do this? The answer depends on what your primary symptom is. If your main struggle is sleep disruption, do the practice within 30 minutes of going to bed. The extended exhale breathing will shift your nervous system into parasympathetic dominance right before sleep onset, giving you the best chance of staying in that state through the night. If your main struggle is daytime hypervigilance and anxiety, do it first thing in the morning, before you check your phone, before you engage with the demands of the day. Starting the day in a parasympathetic state creates a foundation that makes the entire day easier. Your stress response will still activate when it needs to, but it will do so from a healthier baseline, and it will return to calm faster. If you can do it twice a day, morning and night, do both, 10 minutes each. That gives you 20 minutes of vagal toning per day, which is enough to produce measurable changes in heart rate variability within the first 2 weeks. And if you miss a day, do not punish yourself. Do not decide the whole practice is ruined, just pick it up the next day. The nervous system does not care about perfection. It cares about repetition over time. There is one more practice I want to share with you that is especially effective for people whose trauma manifests as emotional numbness or dissociation, the dorsal vagal shutdown state. If you spend a lot of time feeling disconnected from your body, feeling like you are watching your life from behind glass, feeling flat or empty or unable to access emotions even when you want to, this technique was designed specifically for that pattern. It is called the physiological sigh. Researchers at Stanford University, led by Dr. Andrew Huberman, identified it as the fastest known method for shifting out of the dorsal vagal state. The technique is this: take 2 short, sharp inhales through your nose in rapid succession. The first fills your lungs partially. The second tops them off completely. Then exhale slowly through your mouth in 1 long breath. 2 quick inhales through the nose, 1 long exhale through the mouth. That is 1 cycle. Do 3 to 5 cycles. What this does is rapidly re-inflate the alveoli in your lungs that have collapsed during shallow breathing, which is characteristic of the dorsal vagal shutdown state. The collapsed alveoli create a buildup of carbon dioxide in the blood, which the brain interprets as danger, which maintains the shutdown. By re-inflating them quickly, you drop the carbon dioxide level. You send a signal of safety to the brainstem, and you create an almost immediate shift from dorsal vagal to ventral vagal activation. The physiological sigh works in seconds, not minutes. For people who experience dissociative episodes, it can be the difference between being trapped in numbness for hours and returning to a state of connection within moments. It does not replace the longer breathing and humming practice, but it is an emergency tool, something you can use in the middle of a flashback, in the middle of a meeting, in the middle of the night when you wake up frozen and disconnected. I want to address one more thing before we bring this all together. There is a common misconception that post-traumatic stress disorder only affects people who have experienced combat or extreme violence. That is wrong. Trauma is not defined by the event. It is defined by the nervous system's response to the event. A car accident, a medical procedure, the sudden loss of someone you love, childhood neglect, emotional abuse, even a single moment of overwhelming helplessness can push the nervous system into the dorsal vagal shutdown pattern. What matters is not what happened to you. What matters is whether your nervous system completed its survival cycle afterward. If it did, you moved on. If it did not, the pattern locked in, and the vagus nerve carries the signature of that incomplete cycle until it is resolved. This means the practices I have described today are not only for combat veterans or survivors of violent crime. They are for anyone whose nervous system got stuck in a pattern it cannot escape on its own. There is research emerging from the University of Zurich showing that even chronic workplace stress, sustained over months or years, can produce vagal tone deficits that mirror those found in post-traumatic stress disorder. The threshold is lower than most people realize. You do not need a single catastrophic event to damage your vagal tone. A sustained period of feeling unsafe, unheard, or overwhelmed can produce the same neurological signature. And the recovery process is the same. Let me tell you what I believe is the most important thing to understand about everything we have covered today. Post-traumatic stress disorder is not a permanent sentence. It is a pattern, a powerful, deeply entrenched, physiologically real pattern that has been written into your nervous system by an experience that overwhelmed it, but it is still a pattern. And patterns can be changed. The vagus nerve is the key. It is the bridge between the traumatic past that your nervous system is still reacting to, and the present moment where you are actually safe. Every time you activate that nerve through breathwork or humming, or the physiological sigh, you are not just calming yourself down temporarily. You are rewiring the circuitry that keeps the trauma alive in your body. You are training your nervous system to find its way back to safety. And with enough repetition, with enough consistency, with enough patience, it does. That woman I told you about at the beginning, the one who had not slept through the night in 11 years, she started with 5 minutes of extended exhale, breathing before bed. That was all. 5 minutes. After 1 week, she slept through the night for the first time in over a decade. She cried, not from sadness, from relief. From the realization that her body was not broken. Her body was waiting for a signal it recognized. She did not need a new diagnosis. She did not need a stronger medication. She needed someone to show her how to speak to her nervous system in a language it could understand. The language of breath, the language of vibration, the language that her body had been listening for since the night the trauma first shut it down. If you are someone who has been carrying this weight for a long time, I want you to hear something clearly. The fact that you are still here, still listening, still looking for answers, means your nervous system has not given up. It is still trying to find its way back, it just needs the right signal. And that signal is not complicated, it is not expensive, it is not hidden behind years of additional therapy, or a prescription you have not tried yet. It is your breath. Inhale for 4, hold for 2, exhale for 8. That is where healing begins. The path from where you are to where you want to be is not as long as you think. It does not require a special device or a surgery or a new medication. It requires 10 to 15 minutes a day of intentional breathing and the willingness to let your nervous system do what it was always designed to do: heal. Start tonight. 5 minutes. Inhale through your nose for 4 counts. Hold for 2. Exhale through your nose for 8 counts. Add humming on the exhale when you are ready. Do it every single day. And pay attention to what changes. Not in your thoughts, in your body. Pay attention to your jaw. Pay attention to your shoulders. Pay attention to how you breathe when you are not thinking about breathing. Because that is where the healing happens. Below the level of thought. In the rhythmic firing of the longest nerve in your body. In the space between one exhale and the next inhale, where your nervous system remembers what safety feels like. If this video helped you understand something about your own experience or about someone you love, share it. Send it to someone who needs to hear this. Someone who has been told they just need to think differently or try harder or take another pill. Leave a comment and tell me what happened during your first session, and if you have not subscribed yet, now is the time. We explore the science of the nervous system every single week, and each video gives you practical tools you can use immediately. Subscribe and turn on notifications so you do not miss what is coming next. This is Parasympathetic.